A very good morning to all of you joining us today as we come to you from one of our live broadcasts and sharing of information with regards to what we as a company can do for you. My name is Dr. Kezwa Nkuna. I am representing Excite Group as a company, a group of companies that specialize in occupational medicine as well as many other services. Today, we're talking about the elimination of risk from the screening process in the workplace. Allow me to share the slides as we are going to be going through them. It is quite important that all of us understand that as and when we are going to be conducting screening in the workplace, we need to be conversant with what needs to be done, how it needs to be done, and how can we as a company assist you in doing exactly that which you are compelled to do. So, my name, as I've said, I'm Dr. Keswell, and I'm going to be going through this information with you. We hope to enlighten you, and we hope that you can be part of the network of services or network of clients that we can be able to service going forward. For those of you who have not necessarily been aware of who I am an occupational medical practitioner with a vast experience in the occupational medicine field, and I am excited to be sharing this information with you. One thing that is being assumed when we talk about the elimination of risk is that you know the risk that you are talking about. However, if you do not make assumptions, because a risk assessment is a totally comprehensive process, which process you need to undertake to document and to file so that you can be able to all the time come back to in years to come. You also need to remember that in the current legislation, we are compelled by law to keep occupational health records for a minimum period of 40 years. And therefore, whatever you do has to be informed by the hazards that are inherent in the workplace. Whether those hazards are imported or part of the work process, that is immaterial, but you need to document that. Now, there's a process which we largely refer to as the HIRA, which is basically standing for Hazard Identification and Risk Assessment. Now, once we talk about elimination, as I've earlier indicated, it implies that you have done a hazard identification and assessed the risk accordingly to know how to mitigate for that risk. Part of the mitigation is elimination. So, we are talking about that today. We're talking about the elimination of the risk during the screening process. The activity under consideration here is screening process. You need to bear the following in mind. Every activity has inherent sub-activities from time to time. But the easiest way of looking at it whenever I do a or conduct a risk assessment or hazard identification and risk assessment is to look at the incoming logistics, the way things or people come in for the work to be done, and you look at how the work is being done, which is the processing method, and how you are moving out whatever finished product or the outgoing logistics. It makes it easier to break it down in that fashion. Different people have different approaches. Thus, I found to be my best approach in ensuring that we can be able to identify each and every activity, the sub activity thereof, and ensure that we don't leave much outside of this process. So the hazard identification process itself needs to look at what is the hazard. Now, currently, the hazard that we are talking about by and large is the hazardous biological agent novel coronavirus, which causes the COVID-19 disease. It is quite important that you remember that each sub activity within your work methods might have different other hazards. You need not forget that, because by and large, now we're concentrating on the hazardous biological agent. However, is it the only thing that we should be considering? No, but yes, currently it is the one thing that is actually wreaking havoc in the whole economy of the world, and therefore we need to pay much attention to it. Incoming logistics, as I have indicated, could be considering your people who are coming back to work. And coming back to work does not necessarily mean anything other than the fact that the person was at home, they are coming back to work. Whether we're talking about after a long period of layoff due to disease, whether we are talking about a normal off duty, or whether we are talking about the fact that they left work yesterday and they are coming back to work this morning, they still represent an incoming element of risk. Because consider this, when somebody leaves work, they go via transport, or they walk, or they drive, whichever way they interact with people. Considering the fact that the coronavirus is amongst people, we need to be sure that we are not exposing ourselves, because if somebody amongst us was with someone else who had a disease called COVID-19, as and when they were on their way to work, they are potentially a person of interest and have been exposed, possibly. So it is very, very important to understand that we need to look at the coming back to work in that context. In a situation where we're talking about schools, the coming back to work could be referring to students and or teachers, as well as support staff. We need not forget that we have visitors from time to time whom we need to consider as part of the process. The raw materials, make sure that you consider what it is. Sometimes you might have to consider how and when do you receive all of those raw materials. You need to make sure that the process has to be specific to each activity within the workflows. Now, this is not about, we're not going to be teaching about risk assessment, but it is quite important that we give you the background in order for you to understand the solutions that we are going to be giving to you. As we have indicated, we are looking at the screening of workers in a workplace, or the screening of students, or the screening of anybody who is in a legally allowed or permitted industry to be back at work. When the risk level has gone down to level 1, these processes are by and large not going to be abandoned, because they will form part of our daily activity, considering the fact that viruses have never disappeared. So, in the screening process, what is it that we need to consider as sub activities? We need to be looking at the temperature taking. We need to be looking at the administering of questionnaires, the interpretation of these findings within the questionnaires, as well as the results of those tests, or the temperature itself that we have taken. What has not been explained and what is of consideration, and which is very, very much a problem, is that we are seeing an influx of and infrared thermal scanners in the market. We need to be aware that this is not going to be a process of just a day or a short period of time. The durability of these equipment need to be considered. But not only the durability of these equipments, but the life cycle cost of that particular infrared thermal scanner needs to be considered. Because as and when it breaks, who's going to fix it? As and when it breaks and it cannot be fixed, how are you going to discard of it? What exactly are we going to be finding ourselves exposing our workplaces to if we do not consider those factors. So it is quite important that as you do your risk assessment, not only do you consider the present, but you consider the life cycle of everything that you are doing. In administering the questionnaire, you need to consider the fact that you might be using paper. And as you use paper, you need to be aware that once a person holds one form and the next holds it, they will be somehow exposing themselves to risks of transmitting whatever it is that the first person who held that form in paper form has had, and they will be transferring it to the next person. These are all things that you need to be aware of. Once you've done the above, you start quantifying the risk. The earlier process we were talking about was the hazard identification and the classification of the hazards itself. But now you need to be looking at what is the frequency of exposure, what is the likelihood that an adverse outcome could happen, and what cost is that going to cost you or your company in the event that finally it happens. Let's take the COVID-19 or the novel coronavirus as we are talking about right now. How frequently exposed are your people? So, when you are looking at people who are entering the workplace, you need to be looking at when they come in the morning, they are actually exposing themselves, whether through the transportation or when they meet as they gather to enter the workplace. So that time is important. However, you're not only going to consider that time alone, you're going to consider that time plus the time they are in the work process, receiving your raw materials, and undergoing the processing of the various activities they are supposed to be going to do in the workplace. So the frequency of over an 8 hour period or shift, how much time are they going to spend being exposed to the potential of getting the novel coronavirus transmitted to them? The likelihood of occurrence is going to be determined by region. Let's take the epicenters that, or the epicenter that is the Western Cape in the South African context currently. The rate or the possibility of somebody getting it when you are in the Western Cape would also differ if you are looking at different metros. So it is quite important to understand that the likelihood of an occurrence happening is based on the regional rate of infection. It doesn't mean that if the region doesn't have much infection, you need to be like lustre in your approach. No, it just means that the likelihood is low compared to other regions. The next thing you need to do is to look at the cost of how much will it cost if it were to happen that you do have people that have been exposed and get infected. Bear in mind that the cost is not only about direct cost, which is the cost of the person being treated and or away from work, but it is the indirect cost of possible closure of your workplace. How much can you be able to withstand should your company be expected to close for 14 days? I need to just give examples where necessary. The consideration of incoming raw materials, we will look simply at the high risk of industries, for example, health and undertakers. But each industry, each company has raw materials that are coming in. It is important that you understand that as and when you consider all these factors, you know what raw process or what raw material are coming, how those raw materials have been produced, whether or not they carry the risk themselves. Because if they do, the exposure of your employees to those raw materials will imply that they have a likelihood that is brought in by that raw material. Whilst the likelihood of a infection in a region would be low, but the source of your raw material being in another province where possibly the rate is higher, as that raw material is brought in, it carries with it the rate or the risk that that particular region where it is originating from has. So it is quite a dynamic process. It's not just an issue of just considering one thing and saying, no, we've done what we can. We have given people personal protective equipment. We'll talk about a little bit of mitigation later. The risk assessment process identifies certain risks within the workplace and ensures that you can be able to put mitigating factors that will lower the risk of transmission. When you are doing the processing, and in this case, if you are going to be doing the workplace screening yourselves, you need to consider certain things again. Over and above the fact that we are talking about personal information, you need to consider who's going to do it and how are the records going to be kept. But remember, if you're going to be using paper, you are likely to get people transmit from one to the next via the passing on of this paper report. It is highly possible that you could consider electronic means. We are going to be talking about that at a later stage. As we've indicated, the durability of thermal scanners needs to also be considered. Once the above process is completed, make sure that you remember for 40 years, your records must be kept. Because if they are not, and 40 years down the line, somebody is going to come back, or within the 40 years, the Occupational Health and Safety Act allows for an employee to come back to indicate that they worked for you and they were exposed to A, B, and C. What we do not know as at present is what will be the long term effect of this COVID 19. However, given the fact that there has been reports of possible infections that have happened that have led to renal failure, for example, a person who will likely end up having to need renal dialysis in the future could always indicate that, look, I was exposed whilst I was at work, and they will always come back to you and say, please provide us with the records if they have not done a full incident investigations at the time of the infection. We need to understand that we need to complement the above process with a walkthrough risk assessment. What is quite interesting is that the COVID 19 is quite fluid and it keeps changing from time to time. Certain symptoms which initially have not been considered have now been brought in and added, and they are supposed to be considered. That fluidity implies that you need to be able to change records as and when is applicable. Consider this. You have gone out to print en masse your forms that you need to give your people who are going to check and say, I don't have a fever, I don't have chills, I don't have this, and it's 9 of them. What about if tomorrow we add another 5? It implies that you need to go back, change the forms that you had printed because the earlier ones are going to be invalidated. It therefore implies that moving to the electronic means would be beneficial to you because there will be no need for you to do mass printing and ultimately end up with useless forms of paper that should not be considered, which in itself as well carries a risk. We are talking about complementing the risk assessment. So, you need to consider the weekly COVID 19 exposure rating. Now, allow me to just tell you more about this. When an employee has been away from work and they come back, you need to consider what else have they done during the time they were off. So part of what you need to do is to be able to ensure that you know their travel history, despite the fact that they did not probably go away for long. It is also possible that they might have hosted visitors from outside the area. All those matters or issues have to be assessed as and when you do your weekly COVID-19 exposure rating. On a daily basis, you need to be doing a different, lighter mode of assessment because that is considered your daily screening and has a few questions as we've indicated before. Please do not forget to put a risk mitigation plan at the end of it all because you cannot remember everything that you have done if you have not written it. You need to always keep records, and as we have said, 40 years is the minimum records in the workplace. We are going to show you what our solution can do for you because it caters for the limitation of risk during the screening process as part of this mitigation of risk. We are going to give you a summarized version here, and we will ensure that if you want us to demonstrate the system to you, we can be able to do so. However, we will need live data in order to demonstrate the system for you. There is no need for you to commit before. We will show you what the system can do, ensure that you understand, and then we will be able to share with you going forward how we are going to support you. I just need to remind everybody here that what we are talking about here is but a portion of our greater services that we offer. Not only are we offering this in line with COVID-19 and current regulations, but we offer many other services in the occupational health field and general health management. Now, let us show you in summary how this looks like. Right at the top, you are going to see that we have the employee who is at home, who goes to work using organized transport or own transport, arrives at the workplace, and there's a company in charge with senior management, moves to his department and starts working there, which is a section of the workplace. And from time to time, they could be gathering from various departments together to ensure that they continue with the work process. This I am putting because I need everybody to understand that what we have is various levels of responsibility. At home, the employee is responsible for his own health alone. In the bus or in the organized transport, it is a collection of few, the driver as well, the transport company as well. Once they get to work, they are now gathering in larger groups, but the company's senior management needs to be able to understand what is happening with their workforce in the workplace. The departmental heads also need to understand what is happening to their workforce in their own department so that they can understand the risk. When they meet for organized meetings, they need to understand what exactly the risk is. The people coming in are themselves the risk. What we have not put here is a visitor entering the workplace somewhere there who needs to be considered. So, what does our system do? It allows for the employee to screen before they leave home because that is when they are able to do their own in their own current space, in their own privacy, without being seen by anybody without being asked questions that are intrusive, and ensuring that they can be able to fill in the information there. I have had many questions where people have asked, what about if this employee is going to lie? The answer is simple. If somebody is going to lie, not only are they going to endanger themselves, but they are endangering their fellow workers. It is quite important to understand as well that if somebody lies, they are all going to assume the next person is lying, and there will be high levels of paranoia in the workplace. It is therefore going to serve a greater purpose not to lie. However, due to the fact that there are policies in the workplace, such policies could be used to compel all employees to ensure that they tell the truth. Should it be picked up that somebody did not become honest with the information provided, certain steps could be taken. The second question that has been asked is, what about these employees? Do they have to have thermal scanners at home? The simple answer is no. They just need a simple thermometer. Most of us have these in our homes. It is an old method, but it works. If you have it in electronic as an electronic device, the better. However, please bear in mind that you need a thermometer just for the temperatures entry. The system, the app that we have designed, takes care of that by ensuring that you can enter information and you can be able to see your own report. It allows also that immediately you enter the information, it gives you an SMS as a response according to the subscription level to say, yes, you are fine, no, you are not, please consider going for a consultation. It further gives you the information as to where that consultation can be given. We are advising televisual consultations, the telemedicine, where you will be able to see the doctor on the other side and or nurse, and you will be able to talk to them. However, you have the option of ensuring that you select your own doctor and you can call him if he doesn't have the app. However, if he does have the televisual consultation app, you will be able to see them face to face without being in touch with them. So all of that is catered for at that level, implying that we are in a position where we can be able to give a real-time data to the patient or the employee as they screen to indicate to them that they are well or we suspect they are not well, they should consider consulting. Secondly, after they have entered that information, there is a transport company that sits there. Should the transport company be also subscribed to the service, the driver will be able to see those people that he is transporting. There is a need for us to change the way we do things because unfortunately, we cannot allow for anyone to just have access to the records because unfortunately, it is records that are confidential. So transport companies need to allocate a particular driver or two who are going to transport particular employees because then if that is taken care of, then those drivers will know that the employee has done an assessment at home and they will be able to see that their risk is within their tolerable risk or normal so that they can allow the employee to come into the bus. For those who are using their own transport, it is fine. This doesn't have to happen. But upon reaching work, the senior management of the company should be able to have a dashboard that is indicating what exactly this employee's status is today. All this information is transmitted real live and it ensures that everybody is aware of what is happening. The information here is presented as dashboards, which dashboards are simply drillable all the way to the level of who it is that it is showing as the numbers on the dashboard, so that the company's senior management would have a view of the overarching company. However, the departmental head will have a view of only his employees that he is directly responsible for. And should it happen that there are organized meetings, depending on the organizer, we will be able to ensure that the organizer can be able to have a view of who is coming, what is their risk status, so that they can be able to be comfortable. We are also making the assumption that once you are going to enter into a meeting room, you have already passed through the department and you have come through the gates. At a later stage, we will be able to be incorporating the access control and activating it such that whoever has not done the assessment would not be allowed to enter the gates of the company. This is for larger corporates. However, we are making the solution available to everybody from small to large companies. It is quite important that you understand that the next level over there is just indicating to you what the screening or what the capabilities are, because the employee will screen and enter the information into the app. They will be able to get their reports. They will then be able to go into a public transport, organized transport to be particular, and then be able to, for the driver who is registered as well as the company that is registered, to be able to have their entry seen and the report view showing everybody else who is part of that transport system. When they get into the workplace, they will then be able to, senior management will be able to see everybody for the company, but the departmental review or departmental heads will be only able to see the report view with drillable functions to see who is and who is not at work and or who has not screened. It would be advisable to not allow anybody who has not done the self-screening to enter the workplace. It is important to understand that the own records refers to the employee. Here, you need to consider access controls. No screening, no ride. The workplace management access to the company dashboard, as I've indicated, and the departmental manager having access to the dashboard of his own workforce, and the sectional head having access to the various people that are there. Over there is just a legend to indicate where. This is where in the workplace or at home or in the bus or in the department. The dashboard is what the employees or the responsible parties there will have access to. And the reports, all reports, have drill down functionalities that are able to ensure that you can be able to see. What is beautiful about our system is this: it is virtual, it is online, but also it goes one step further to allow for virtual online consultations post screening should there be a need. We have still retained the power of the pen because we record all clinical information. As we have said, we have the capability to have a drill down function per day, per week, per month, per whatever period that we would like to have the report. It is therefore important that management understand that as and when we do what we do, we're doing it to ensure that it is easier for them to manage their workforce. What are the advantages that the online and virtual gives you over physical? It eliminates the paper records, thus limiting the chances of transmission as earlier indicated. It avoids the exposure of the employees to unhealthy ones, especially where you do not know, but therefore it allows for that and or promotes that social distancing that we always talk about. But more importantly, the risk of stigmatization is also reduced Because when you look at what is to happen, should an employee be screened in the workplace, there has to be certain provisions that are made. One of them being that they have to be put one side and allowed to consult accordingly. How is that consultation going to be made? If it is online, it is fine. If it is via transport, it implies that the company has to take that patient to a medical center and in the process be exposing the driver to possibilities that he or she might be driving somebody who has COVID-19. Because of the duty to inform and the duty to obey lawful instruction on the part of the employer and the employee, respectively, it implies that the employer will now be liable should the driver of the vehicle transporting his colleague to the medical facility, if that employee is exposed and he gets sick, the employer then has liability despite the fact that the work processes might not be considering or might not be having the hazardous biological agents. Again, you need to be aware that should it be that the employees are taken via a separate path into a different room, the other employees and colleagues might be able to see that. Doesn't that promote this stigma? Because these are issues that we need to be considerate of. We need to be aware that this app gives the responsible parties control by allowing a 360-degree view of the employee's overall health on the dashboard. We are able to incorporate other processes, but as we have said, we are only looking at the COVID-19 currently. It is important that visitors are put into the system as well, because it then will be able to say, as we screen this person, what exactly is happening to him or her and be able to understand the risk that that person poses. The Excite Health EMR, the electronic medical record or electronic record, it gives you various benefits. It gives you the daily monitoring. It makes you get the weekly exposure ratings tool. It allows for monitoring without infringing on clients or employee privacy. And the employee can also select their own healthcare professionals upon registration. This will allow for them to actually consult their own doctors should they need in the event that they find themselves having to be screened and or tested accordingly. Always the client receives an SMS in an email and an email in a live, no delays environment. We have linked the tool to the virtual platform, as we have said, for our clinics, where we can be able to provide televisual consultations. And more importantly, the employer has the ability to drill down on the reports. The app is accessible in many ways. A lot of times we have been asked the question, but what about employees that do not have data? So here is the simple solution, and let me take you through it. The first thing is for the employee who has a smartphone and has data, self-monitoring is easy because then they access the app through a secure portal and enter their details and submit. However, they can do that at home. They can do that whilst at the parking lot in the event that they want to do it that way. And we also have the capability to use SMS functionalities. Of course, that depends on the costs as well, because there are higher costs associated with that, because each question has to be separated. And also, there's the option of the telephonic assisted monitoring. We also have customized solutions that we can be able to put in any workplace. However, for the purpose of us doing this, we are not considering that at all in this presentation. However, we can be able to do it as and when the employer is needing it. We cater for the employee who has a smartphone but no data, as we have said. They can come, drive into the workplace, you give them Wi-Fi access, and they can be able to fill in the information before they enter the workplace. And those that do not have the ability to, we need to be able to consider, if they are illiterate or they are not able to read in the language that the app is in, which is English, we need to then be able to assist them telephonically. And as we have said, there is a cost associated with that. Moreover than just this issue of giving access to this app, we provide other services. We also provide employee training via our e-learning channel, and we are able to appropriately teach people about the appropriate use and selection of PPE, the COVID-19 layman outline, the hygiene services and advice that we give. We don't do the hygiene services, but we are able to advise and train people accordingly, because disinfection and cleaning are two different things. But at all times, whenever we have a challenge or we uptake you, we will take you through the theoretical information sharing. We will always be ensuring that we teach you what you could see on paper, but we don't approve of that. We want the electronic method as a preferred method. As we have said, we are here for you. We deliver through the various platforms, but at times you might want us to reach out to you. We are able to do that within reasonability, of course. We are not going to be discussing the cost, however, depending on the size of your unit, we can be able to tailor make certain solutions. We group clients according to their total number of employees. We ensure that various services are costed accordingly, and people and or employers are able to understand what it means. For schools, we are able to ensure that the school will join. However, for the children, we can be able to ensure that the parents subscribe to this app so that they can be able to bear the cost. As we have said, there are unit costs that are applicable. Now, let me just take you through a little bit of a demonstration. Step one, after all the administrative processes have been taken care of, is that we give you access, which is secure, and we ensure that you register online after having been uptaken so that it will identify you as and when you register. The steps are as follows. The company registers first, the employees register second. The company, should they have an occupational medical practitioner, their details is entered. However, in the event that the company doesn't have occupational medical practitioner, we will give access to that. Secondly, the employee will register as a service user. We will then be able to give that employee access to the app, and they will be able to also, as part of the registration, select who their doctor is if they are registered. If not, they have the ability to enter or add the doctor into the system. It is assumed that if they are going to enter the doctor themselves, they have already requested the doctor to be part of their health service provision. It means that you need to get permission from your doctor through getting specific information like their practice number, their council number, and their mobile number, because those numbers and their emails are the emails that the system or the app will use to communicate with them should you need to communicate with them. After registering, you will need to be able to access your own data form, and on daily basis you'll be able to do the daily uptake. As we have said, in the event that you, as you do your daily screening, there is suspicion of disease, you will be getting an SMS which will be saying, "Dear whoever you will be, the results of your screening indicate a suspicion of sickness. Please schedule an appointment with doctor as you have indicated who your doctor is. In the event you have not and your company has a particular doctor, it will send that information of that particular doctor. It will then put a link as to where you can be able to see that patient, that doctor. You will enter the information as requested on that app of the scheduling, and you will then be able to consult online. We are not going to be talking more about this, but it is a tool that we have already. And in one of our live broadcasts, we're going to be talking about it as well. As we have said, the employer gets dashboard reports, which dashboard reports have various capabilities. You drill down on the number or on the pie chart or any other chart that will be there. You will be able to see what that chart represents, and you will be able to see what information is behind that form. What you are likely to see, those numbers might be indicating number of people that have been tested to date and or screened. And as you click the number, it will then show you. But as we said, each department will have its own employees. So the various department will have access to this information. What is quite important to understand is that as the department has information to this, they've got to be using one reference point. No reference points that are different will be allowed because it allows for more people to have different or to have access to people's records. But for the company, this dashboard is for the overall company, as referring to the company's senior management will have access to the overall information on this dashboard for the whole company. For the department, the departmental head will have access to this information for his department only. For the employee or the client, that information is only pertaining to them as per their dashboard. It has been a very technical presentation. I need to just stress out that in the event that you wish to have this information, you can always contact us for a live demonstration and we will be able to demonstrate accordingly. You can contact me personally, or you can be able to contact us via the admin at xiteinfotech.com and you will be able to reach us. In summary, before I close, here is our slide as what services are we able to provide you. We are a company in the safety and health. We do all services that are related to that. We are a company in the health space. We do consultations and clinical advisory services. We have an online training platform, the e-learning platform, and we are able to train your employees for COVID-19 and other related issues. But over and above, we are and we have been targeting that platform to conduct training for all our partners for all the other needs other than just COVID-19. We also have a digital reach, implying that we automate most of our processes and we can be able to be of service to anyone within the borders of the country, online, outside of the borders of the country as well. It's possible, but for now we are only dealing with South Africa. And as we have said, we are able to provide service consulting that will ensure that your workplace is always healthy. I just need to ensure that I mention this, that the presentation is going to be made available through the various platforms that we have indicated. They will be available on Facebook after processing, as well as YouTube. We have got other training sessions that we have, put together that will be live broadcasts, and they will always be available post live broadcast as recordings. I would like to take this opportunity to thank you for having joined us. And should it be possible, you can be able to reach us on those details that are indicated on the screen. Thank you very much, and may you be remaining safe. We are here for you all the time.